This is my patient, Jordona, and Jordana comes in periodically to get checked out. Going through her basic exam, she has no lower reflexes that are intact or working properly. So all her lower body muscles are inhibited. Here I come to check her TMJ because that's something that she has frequently that's out. I want to give her a little stimulation on that right-sided TMJ, and I go back to check her lower reflexes, and there's no change. To just double check, I put a tongue depressor in to gap her jaw, and once again, no change. Here I go check her lower cervicals to see what impact her C7 has. No change. And I think on that one I checked her upper cervicals, and once again no change. So at this point I recognize that whatever is causing her lower body weakness is not in her cervical spine or in her jaw. So I put her on her stomach, and we're going to go look for something that's dysfunctional in her sacral area.
Good. Try this side though. Let me straighten. Good.
This is a gallant reflex. Should cause weakness on the same side as the test, and it does both of those examples there. In a crosscourt reflex, it should be strong. It is. And here it is not. I'm going to double check it to make certain I didn't do the testing properly. And once again, it's inhibited. That's abnormal. We're pushing the sacrum to one side to test if I adjust in that side, will that make the reflex normal? And in this example, it does. Here I want to double check, so I want to push the sacrum to the right, redo the test. It's still abnormal. I'm going to check to the left again, and once again it becomes normal. So that tells me at this point we're going to be adjusting our sacrum to the left or the right side of the table, depending on what your reference point is. Here I'm going to give Jordana a little trigger point therapy, longer spine. We'll speed this up.
I had to go get it. They didn't know what I was talking about.
We have one here.
I felt that. I'm trying.
I know you are. I'm not discounting that.
So interestingly, that adjustment did not correct her lower body weakness, which tells me there's still something out. We went back and rechecked the cervical spine, and lo and behold, there it was. It was the C1 that was out, but it was secondary to a sacral issue. Jordana also has a blood glucose issue, which we're going to be working on in the future. That's something very important with all patients, that if you have some type of inability to use sugar properly, that will cause your muscles to shut down. Here I'm doing a little true point therapy on her occipital muscles and her upper cervical muscles. As with most of my patients, I always do therapy on the feet. A lot of proprioceptive signals are sent from the feet, obviously, to the rest of the brain, the spinal cord, to coordinate muscles. So always treat the feet and ankles with metatarsal.
Your favorite.
This is a great adjustment for Jordana. What's interesting is to watch how sometimes you have to time your thrust, your adjustment with the breathing, and the patient's ability to relax and take the adjustment. This is a small little cerebellar exercise I wanted to do with Jordana on top of some nutritional therapies we're going to be applying to her.
Like this. Bounce.
I want Jordana to stress her system, and I want her to walk in her body, stress it, get her back on the table, and see if actually everything holds and stays in place the way it's supposed to, and if her reflexes are normal. And she passes the test.